First speaker is Kevin Boldt from Calgary. He's been here for the last 10 or 11 weeks. It's an exchange program which you may not be aware of between Calgary and University of Auckland. Unfortunately, it doesn't quite mesh in terms of time, unfortunately. So Kevin's been doing little bits of a couple of papers, so it hasn't fit it perfectly, but I think, did you say 303? You're working with Sharon, I think, yes? And so Kevin is here for another few weeks, and then we'll continue his program when he gets home and complete his degree next year in June or so. And he tells me that he's not sure what's going to happen after that, but it will be some kind of postgraduate work. So welcome here. Thank you for coming to talk with us. You can see Kevin's title there, so go for it. Thank you.
Thank you. Well, guys, good afternoon. I'll be presenting to you on behalf of the USRP Health and Wellness Lab on our work with exercise programming for cancer survivors, and mainly the ENHANCE program and the THRIVE program. So me, I'm Kevin Boldt. I'm from the University of Calgary. I'm on exchange here at the University of Auckland. My focus of my degree is in physiology, well, you guys call it sports science. And I'm focusing in mind science, which looks at sports psychology, exercise psychology, and the neuromuscular basis of movement. So for the past year, I worked for the USRP Health and Wellness Lab as a research assistant and the volunteer coordinator of the THRIVE Center. I've held the PEER grant, which is the Program for Undergraduate Research Experience, and currently the Undergraduate Student Research Project, which is the presentation is a part of. So jumping right in, cancer is an abnormal and unnatural proliferation of cells. What this means is that the cells of the body begin to reproduce at an unnatural and uncontrollable rate, forming tumors. The effect of a tumor can vary depending on the site, size, and the type of tumor that it is. However, most tumors, or cancer today, is becoming a large problem for both the population level and the individual level. In 2009, the Ministry for Health reported 20,875 new diagnoses of cancer in New Zealand. So this means each year there's over 20,000 new diagnoses each year. That's not including cancer recurrence or metastases. In a later publication, Tell the Price of Cancer, the Ministry for Health also reported that mean cost of a single diagnosis is $20,000. So from a population standpoint, cancer is a large drain on the healthcare system and the finances of the country. But the problem with cancer isn't always losing patients. In fact, survival rates are on the rise, which is a great problem. However, we're presented with a new problem, and that is a large body of cancer survivors who are facing decreased quality of life. Survivors are frequently cured and deemed cured by the healthcare system. However, they don't return to the same levels of quality of life. They don't gain back the same life that they had before. They still feel many side effects from the treatment and the cancer itself, things like fatigue, depression, anxiety, muscular weakness, and even appetite. Many of these variables show up during treatment, however, can perpetuate long into survivorship. So the cancer is gone, but they are not truly healed. And in light of these increasing survival rates, the focus on research has been slowly shifting from improving quantity of life to quality of life. And out of that shift, exercise has been garnering quite a bit of attention. Exercise provides a unique approach to cancer treatment in that it has many effects. For example, it decreases mortality. It's able to improve treatment completion rates by decreasing the effects of toxicity from chemotherapy and radiation. The participants are able to undergo more treatment, and therefore improves the incidence of, or decreases the incidence of mortality. It's also been shown to decrease cancer occurrence and recurrence into survivorship and morbidity. So things like chemotherapy and radiation are actually cardiotoxic, which means they adversely affect the heart later in life. So things like exercise can improve the heart health and decrease comorbidities late in survivorship. And it's not a new concept to any of you guys that exercise has physical benefits. It can improve physical strength, physical endurance, work capacity, those kind of things, but even psychological, depression, anxiety, all those types of things. But from the cancer standpoint, we had to prove that it was both safe for cancer survivors to engage in, as well as beneficial for them at the same time. So from a physical standpoint, the research has shown that exercise for cancer survivors can improve physical strength, physical endurance, aerobic capacity, flexibility, and overall physical functioning. It's also good for fatigue. Fatigue is the #1 patient-reported side effect from cancer treatment, and often because of a vicious cycle, where the patient is instructed to rest. And when they rest, they can be conditioned, so when they have to do activities of life, say walk up the stairs, it tires them out even worse. So they rest more, they get more deconditioned, so when they do activities, they get even more tired, more rest, more deconditioning. It's a vicious cycle. Where exercise is able to break that cycle by increasing the muscular strength and the physical functioning of the individual. Now, from a psychological standpoint, exercise has also been very beneficial. There's one study that used an exercise intervention and compared it to a traditional therapy for cancer survivors called cognitive behavioral therapy. What they found was exercise was actually as effective as a traditional psychological cancer treatment. Exercise is also adept at providing a social environment. Exercise groups are very good for social support. The basic camaraderie of the actual group provides a place where survivors can naturally get that social support. Many survivors don't feel comfortable going to a traditional support group where they talk about their feelings and sit down in a quiet room, whereas if they're exercising with like-minded people who have similar experiences, it naturally comes out and they're able to express themselves in that way. So throughout the literature, these benefits have been found regardless of the exercise modality and regardless of the diagnosis. Why do I do that? Is there's been studies that have used things like aerobic training, cardiovascular, things like walking or running, resistance training, some sports. There's been some basketball studies, some soccer studies, and even Reagan bowling, which is a type of rowing. Things like yoga have been used. And then regardless of diagnosis, there's studies with breast cancer, prostate cancer, colorectal, lung, and head, neck, and brain. As well as between stages, there's studies that look at palliative care all the way to preventative, through pre-treatment, during treatment, and post-treatment. And all have found the same sort of benefits. So digging into our program is the ENHANCE program. It stands for the Exercise for Neuro, Head, and Neck Cancer Survivors. It's a 12-week exercise program investing in the quality of life for head, neck, and brain tumor survivors. Now, the reason we chose head, neck, and brain tumor survivors is, first of all, because it's underrepresented in the exercise literature. There's not a lot of studies that have used these populations. And secondly, because these two populations are prone to changes in body composition. Head and neck survivors often undergo cachexia, which is severe muscle wasting, which causes sharp decreases in their muscular strength. We even had some participants in the program who are unable to stand out of a chair. They report going to the toilet and not being able to stand up by themselves afterwards, which has a serious effect on their quality of life. On the other hand, brain tumor survivors, when combined with some of the drugs to decrease the swelling of the brain tumor itself, causes a hyperactivity. And when that's combined with general changes in lifestyle as a result of treatment, they're prone to increases in fat mass. So recruitment for the program was based on physician referral out of the Tom Becker Cancer Treatment Center in Calgary, Canada. The reason we want physician referral is for two reasons. Firstly, the exercise psychology literature shows that when a physician will refer exercise or prescribe it, the participant is more likely to engage in that behavior than if it's just on their own accord. And secondly, we want to show that exercise can be engaged within the clinic, that we can get the support of the clinicians, and that exercise can have the same benefits during treatment within the healthcare system, working with integrative and holistic care. So when participants were recruited into the program, they underwent initial assessment and an education session. The education focused on the benefits of exercise, the benefits for them as cancer survivors, and what the program itself was entailing, so what they were signed up for. Based on the results of their physical assessment, they were prescribed an individual exercise program. All participants were given exercise ball and exercise bands. They can complete the program both at home as well as at a weekly exercise session with us. So we held weekly exercise sessions for both head, neck, and brain. The head and neck sessions focused on rebuilding the muscle mass, so heavy strength training as well as flexibility, whereas the brain tumors focused more on cardiovascular to either decrease, reverse, or try to hopefully buffer the increase in fat mass. physical assessment consisted of a hand grip test, which is a predictor of overall upper body strength, 30-second sit-stand test, which is for lower body strength and muscular endurance, a 6-minute walk test, which recorded aerobic capacity, and general body measures for anthropometrics, things like weight, circumferences, or height, weight, all those kind of things. Psychologically, we use the personal well-being checklist, which is a validated and reliable measurement tool for psychological stress. It's a 0 to 10 scale, where participants self-report feelings of anxiety, depression, pain, overall well-being, just general psychological measurements. We also recorded adherence, so we wanted to know what participants were doing throughout the program, in addition to just the once a week with us. So we looked at the frequency of exercise, the intensity of that exercise, the type they were doing, and the time that they were doing it for.